I disconnect the sound. Oh no way, because dit is daar.
Nee, steek een blik op. Ja, nee, zij is echt. Ik ben er toevallig ja, ik word wel. Ja, die wordt federatie, maar.
No. Because online. On YouTube. I was distributed my bit. But I was talking with a lot of things like ending writing all the right. So nice to meet you. Nice to meet you, Leanne.
Nice to meet you. Hi, Andreas. Nice to meet you, Andreas.
Well, you need to be on this one.
No, actually,
Oh,
managed to.
oh, that's very interesting.
Was
Let's see your best.
actually, I'm in the geometry. I'm not a yeah, no. Well, I deal a lot with the part of my China and then we only three of us, so we have
I like that. Yeah. But I think I've worked more with like Zen like Christy on your yeah, so I think yeah. No, I work actually on sexual health. I used to work in it because I was someone.
no, you say no, I didn't, but I did.
I mean,
Yeah. That's all the issue where. But they're very.
Yes, I spoke up. I know.
But I have a lot of experience teaching.
I don't know. Yeah.
No, actually, it was no, the part. You good? Yeah, I'm actually
Yeah.
Oh, yeah. I know.
Yeah.
Yeah.
Earlier.
Yeah, I can assure you.
When I go to the conference, I go to Africa, I feel something.
Yeah.
Yeah.
And all the times that I need to leave.
Yeah. Maybe you should.
We did.
Yeah, it does. Actually, my boss, she means stuff.
Yeah, I mean, that's why I like the reality.
She worked on her thing, she's got 8%. So they gave her a shot. Yeah.
So I had a colleague on there this year.
Yeah.
That was like very good. Shot means taking the same thing.
Yeah, it is.
Pretty much.
Yeah. That's with everything. Always the-
I put all of the pictures.
Yeah.
When you finish up with what I am really in
I can see it.
To get it.
Get it. Yeah.
Yeah. Sure. See you again. You have a very busy schedule today. It is a very busy day at the WHA. I think there were so many side events on Wednesday. Speaking at one of our events this morning on the installation.
Oh, okay. Okay.
There was a brilliant program.
Where was that?
At the Warwick.
Okay.
Oh, that's the 8 AM.
No, it was in the morning. It's like a close round table.
All right.
Nice to meet you, by the way.
Hi, Elena.
Elena.
Okay. And legends?
You have something on your back.
Oh, yeah.
Yeah. Yes.
Yeah.
It was really great. Only the like Spanish translation was, but yeah, it's always technical. Oh yeah, someone was going to get work for us.
Oh, all right. We got 5 minutes, so if there's a coffee desire, it's just a big time.
Yeah, we're going to go.
It's overly happening. Okay, but you want to go there?
I think someone's getting it. I hope someone's getting it.
Yeah.
Yes, I'll get back to you. Yeah. Oh, thank you.
Yeah.
Yeah, that's your, that expense.
Nice.
Like, but I can speak that.
How big is the STP delegation? Okay. So you guys just bring yourselves back.
You know, it's stressful.
Right, thank you.
Just you're like, oh, I have fun. Thank you so much.
WHA, right?
It's really intense, yeah. There's some team up here.
Yeah. I actually, many WHAs.
Okay, then you know better than how it feels, so yeah.
But sometimes it's incredibly different. There's things that relate.
Yeah.
But it's
I was like, do I feel underprepared or could I not? And I think it's the second one. Because I think as much as you're prepared until you're there, and
yeah.
it's so different.
Exactly.
And so many things happening at once.
Yeah. Well,
He was a bit, it's with most of people, but yeah. Danielle, is Danielle the way they set the agenda? Yeah, exactly. I'm still not sure where I could be going to update the agenda.
Yeah.
I think I downloaded it, but never looked at it after that. It's not user friendly. No? Okay. But I'm still gonna use it. Anyway, but.
Yeah, sometimes.
What is this?
Well, it's years. But yeah, yeah. Yeah, I don't think it's. But they have.
Which one do you prefer? Third, 3 months. No, but the other one is the small one. I think we can pass. Yeah. One, two, four. Yeah, this one's so curious. I'm making a book.
Yeah, I think a lot of us.
Oh, like, doesn't be fine out about it? Is it, you guys say anything, would be like, like that. Okay, and like comments. Yeah, but those people have a special event like that. I mean,
hello, we'll be getting started. Welcome back. Well, first of all, welcome to our assignment on the inequalities in adolescent health. So according to the WHO, there are 1.3 billion adolescents today living across the globe. Adolescence, which is defined by the UN as a period between 6 and 19, is a critical period of physical, emotional, and social development that sets a foundation for future health and well-being. Investing in adolescents can have long-lasting benefits for individuals and society as a whole. So the report by the Secretary General on the Global Strategy for Women's and Children's and Adolescent Health have received significant attention during the WHO, receiving numerous interventions on the floor by member states. So the Global Strategy itself was launched in September 2010 with the aim to regularly monitor the progress and global trends made in women's, children's, and adolescent health. So analyze the barriers to equitable health outcomes and set the path forward after the WHO. So it encourages member states to take on a left course approach, beginning from women's health, and has several guiding principles, including being gender responsive and equity driven, in order to achieve the vision of a world in which every woman, child, adolescent, in every setting realizes their rights to physical and mental health and well-being, has social-economic opportunities, and is able to participate fully in shaping prosperous and sustainable societies by 2023. Ensuring safe transition from childhood to adolescence becomes vital. The report made by Dr. Tedros at this year's WHO highlighted many things, some that were promising and others not so much. In terms of the trends in adolescent health specifically, so the prevalence of mental health issues and gender-based violence, especially intimate partner violence and non-partner sexual violence, remain extremely high, especially in the setting of the COVID-19 pandemic. However, there's also a decrease in adolescent pregnancy rate accompanied by an increase in the use of contraception. So having now passed the halfway mark of the strategy. So it's pretty clear that there are so many areas that we have a long way to go, but the process has definitely been made. So in today's world, adolescent health remains this highly intersectional issue, being compacted by a variety of socioeconomic factors. The global strategy encourages countries to take on a holistic approach to improve adolescent health, including financing, investing in healthcare resilience, realizing individual potentials, and also research and innovation. One of the major strategies for improving the health of adolescents is through comprehensive sexuality education. So it aims to equip adolescents with the necessary knowledge, skills, and attitude to their health, and promotes positive societal sexual and reproductive health outcomes, supports healthy relationships, and addresses social and cultural factors, contributing to discrimination and inequalities. But unfortunately, many young people around the world do not have access to CSE due to cultural, religious, financial, and political barriers. So with a rapidly changing post-pandemic world, there remains much room for research and also innovation. So why is it important that we include adolescents in our health agenda? What are some of the barriers that they experience when accessing the help they're entitled to? And also, how does CSE help shape adolescent health? Very luckily, so today we have an amazing panel to answer our burning questions. So we'll just do a briefly introduce of the speakers. So first of all, we have Claudia Schmus. So Claudia is a medical intern from Poland, serving as the liaison officer for sexual and reproductive health and rights issues, including HIV and AIDS at the International Federation for Medical Student Associations, which represent 1.5 million medical students from 130 countries. She has worked in the field of SRHR for 8 years, with special interests in gender equality, gender and sexuality diversity, and sexual health, implementing intersectional approach such as effects of climate change on SRHR, access to services by vulnerable populations, or health literacy in the context of sexual and reproductive health. She's also experienced in advocacy for adolescent health and meaningful youth engagement. On the national level, she worked on advocating for access to safe abortion, family planning, comprehensive sexuality education, HIV and AIDS prevention, and eliminating discrimination against LGBTQI+ community through policy papers, grassroots campaigns, and workforce education. Welcome, Claudia. So we also have Elo Tobo. So Elo Tobo is a global health expert in advocacy, policy, program delivery in low and middle income countries. She's a senior health advocacy and policy advisor at Save the Children UK, where she leads a portfolio on women, child, and adolescent health and sexual and reproductive health and rights. She is also the technical lead for global health partnerships. She represents Save the Children on PMNCH Strategic Advocacy Committee, the UK SRHR network, and co-chairs the UK Maternal and Newborn Health Working Group. Previously, she has driven programs in Madagascar and Ghana, improving direct health service delivery to pregnant women and adolescent girls. She has considerable experience in maternal service delivery and access to SRHR and family planning for adolescents. Welcome, Azar. Next, we have Elena Alam. So Elena Alam is a final year medical student from the Netherlands. So this year, she's a youth delegate in the Dutch delegation to the 76th Warehouse Assembly. During her studies, she has also been actively involved in the International Federation of Medical Student Association, working on global health topics in 130 countries. Because of her past experiences in the medical field, women's rights, and planetary health are her focus points during her term as youth delegate. Furthermore, in her role as youth delegate, she advocates for meaningful youth engagement at all levels. Welcome, Elena. Next, we have Andreas. So Andreas Hermerson is the senior advisor at the Joint United Nations Program on HIV and AIDS. As part of its gender team in Equality and Rights for All practice, Andreas deals with UNA's flagship initiated Education Plus. A national of Sweden, Andreas previously served as diplomat and focal point for SRHR in Sweden's feminist foreign policy, as well as other gender and health-related matters at the country's mission into Geneva and Europe. Welcome, Andrea. And last but not least, we have Leanne. Leanne Gonzalez is a scientist for sexual health in the WHO's Department of Sexual and Reproductive Health and Research in Geneva. Her research, policy, advocacy work covers topics ranging from sexual pleasure to menopause. She previously led research for WHO exploring how young people can access SRH information and service outside of health facility settings. Before WHO, she worked on SRHR research and programming in Venezuela and Ethiopia. She has a Master in of Science in Public Health from the Johns Hopkins University School of Public Health and a PhD from the University of Basel. Welcome again. So we'll get started with the panel discussion. Another welcome to our speakers. So first question. So as discussed earlier, adolescence is such a crucial period of life, and adolescent health should definitely be informed on all levels. And its progress and efforts should be sustained and constantly monitored. So this first question is for Liane, Elena, and Andreas. So what's at stake if we leave adolescents behind in global and national health agenda? So might start with Liane.
Great, thank you. Thank you so much for having me. And thank you for that excellent introduction as well. I mean, I think your numbers at the top kind of made a great argument in and of itself. We're talking 1.3 billion. So if the sheer quantity, like the 1 in 6 people on this planet being adolescents is not enough of a health argument, I don't know what is. And I think obviously we know that that's distributed differently around the world. I think something like 90% of the world's adolescents are concentrated in low and middle income countries. So we need to make sure that we see this prioritization of these young people where they're at. I come at this from like the science side and the health side. And what I always love talking about in the second decade in adolescence is that it is a biological transition. Adolescents aren't like big children and they're not tiny adults. They are literally going through physical, cognitive, emotional, and social changes. And we need to make sure that health services are responsive. A great example is, all the changes related to puberty. That is something that happens in that second decade where adolescents need to be supported. And we also know that the health burden and the disease burden that we see for adolescents reflects this transition. So we know that in, say, the 10 to 14-year-old range, the real burden with mortality tends to be more around infectious diseases, while when you hit 15 to 19, we're starting to see things related to behavioral changes, risk, young people being out in the world. I think just in terms of saying what's at stake, if we don't prioritize adolescent health, I don't think it's over dramatic to say the entire SDG agenda, because I think that so much, if we talk about what good investment in development broadly looks at. I mean, we have a lot of doctors and future doctors who are tuning in and listening. We know that prevention is the best cure. So if we're investing at a foundational level and giving young people not only the information and skills that they need to be healthy then in that moment, but also to become healthy adults and healthy and productive parents of future generations, that is how we're going to be hitting our SDGs on things like gender equality, on health, on addressing non-communicable disease, on addressing, the HIV epidemic, et cetera. So, I think that we talk about investments in adolescence, everyone wants to see a good return on investment, and we talk about it being a triple dividend. It's that dividend of helping young people today where they're at, helping them in the future, and then helping all those who will be dependent on them in the future. And of course, I obviously come from the health space, but we can't underestimate what equipping young people with healthy behaviors does outside of the health sector. It allows them to stay in school. It allows them to become better and more productive members of society. Giving them healthy behaviors now, make sure that they're not, they and health systems are not burdened by disease, non-communicable diseases, disability later on in life. I hope that that's a good argument, but I think it's a wonderful investment.
Thank you very much. And also thanks for the invitation and for the warm welcome and introduction. I can say that we are quite aligned in terms of our thinking on this question, and for a good reason. So I want to answer this question by just raising 5 quick points, and many of them align very well with the previous speaker. And in terms of the first one, the demographic issue, of course, the data and the fact that 16% of the global population, as we heard, 1.3 billion, and that in some countries that account for more than a quarter of the population. I think that is really a very good argument, and that this is projected, the number of adolescents is projected to grow to 2050. So it's going to be even more of an argument. And that brings me to the second point that we also heard of in terms of the SDGs, because we will not be able to reach the SDGs if we do not invest more in adolescent health, and in particular those most left behind. And the third point was also mentioned that I wanted to mention is in terms of the life phase itself, and the fact that it is really a period where many factors that contribute to lifelong health are being acquired and solidified or not. I mean, that's the thing. And then the triple dividend, of course, is very important as well. And then the fifth point, and last but not least, of course, you heard I'm from UNA, so I want to bring also the HIV angle. The AIDS response in itself, I think, is a very good proof of the importance of focusing on adolescent health. And the AIDS response since the very beginning and up until today has been very crucial in terms of its contribution to adolescent empowerment, human rights, and fighting inequalities. And our new strategy, five-year strategy, has really one of its main focuses fighting inequalities, and adolescents is a very important group. It is a priority group because they are so disproportionately affected by the HIV epidemic. So in terms of new infections globally, 27% of them occur among adolescents. So, and for example, in sub-Saharan Africa, every third minute in 2021, a new girl was infected by HIV. So that's pretty telling. So there's lots of data, there's lots of evidence. We know the cost of inaction. And we also, and I think this is important, we also know that a vast majority of adolescent health issues are preventable and treatable. So I think all these arguments should really encourage every single decision maker in the world to boost action on adolescent health.
Thank you so much for your Andrea.
Thank you for the invitation as well. I think we're very like-minded. You said it as well. I have the same points written down. So I want to give a quick, different perspective to the question. So not leave adolescent health behind, but adolescents themselves, maybe. I think if we leave them behind in the global national health agendas, which was your question, we also miss out on a lot of solutions. I think adolescents themselves know best what their health wants are, the solutions to those health wants. I think they are very creative and optimistic group of people, not group, but 1.6 billion of them. So I do think that if we don't engage these young people, these adolescents, we will miss out on a lot of solutions.
Thank you so much for speakers. So yeah, as you said, Ian, so just like judging by the numbers, it takes such like the sheer quantity of adolescents that take up in our general population, and also the importance of taking like age-appropriate responses because different groups of adolescents. I think sometimes we kind of oversee like the diversity within the group of adolescents. So each of them have very diverse, especially us as like medical students, the importance of like caring for each one of them holistically. So thank you so much for bringing that point. And also Andreas, absolutely. So for like SDGs, like having taken like a very comprehensive like approach to adolescent health. And also you mentioned like the approaches like UNAIDS is taking and how adolescents are like disproportionately like affected by that problem. So thank you so much for sharing with us. And yes, Elena, so absolutely for not just leaving adolescent health behind, but also like letting adolescents make their own decisions, be involved in healthcare. Thank you so much to our amazing speakers. So next question. So basically several studies done on the international level have proven to be essential in terms of safeguarding adolescents' health. especially in areas such as menstrual hygiene, preventing adolescent health, pregnancy, and sexually transmitted diseases. So those are all things like, for instance, sexuality education can do for adolescents. So like the existing evidence for CSE's benefit serves as a very critical tool to advocate for the widespread adoption and effective implementation of CSE. So the next question is for Claudia, Andrea, and Ian. So based on this evidence, what are the key benefits of CSE in terms of positive health outcomes in adolescents?
Okay, so hello everyone. I would like to start on the critical role of the CSE in communication or like building healthy relationships, and also how it affects, like implements positive attitudes. So I would like to start with the benefits of mental health, which is extremely important for left behind populations such as LGBTQI community, because it significantly reduces the stigma for them and also decreases the minority stress. Another thing I would like to emphasize that in the definition of health, we also have well-being. So having healthy relationships also contributes to health overall. And this is where we actually, in adolescence, is where we teach how we learn how to interact between each other. So this is the critical time in which this curricula can be crucial in developing that. Another point that I wanted to raise is that comprehensive sexuality education helps us to understand our own health needs. It increases our health literacy, and it helps us to make informed decisions about health. So with that knowledge, we can refer to healthcare provider on time and in a relevant moment, early enough, so that also creates that sets the foundation of like early prevention and so on. And I think most of the points on that I also wrote will be brought up by Andreas and Bian, because I wanted to also mention the benefits on reduced STIs, as also you have mentioned, and adolescents pregnancy. But also bringing the point that sexual health is also very overlooked when it comes to health concept. So I would say that CSE also helps us to have more open communication around health, around sexuality as well. And yes, so that will be also a benefit on sexual health. So that's all from me.
Okay, so thank you. Again, I want to bring the HIV perspective to this, and the fact is that only 1 in 3 young people globally have accurate knowledge about HIV prevention. And we all know, of course, that preventing new infections require knowledge and information about sexuality, your body, etc. So that's really key. So for UNAIDS, of course, CSE is a very important tool. And I'm speaking again about adolescent girls and young women in sub-Saharan Africa, as I mentioned earlier, where the infection rates are really, really high. And there, the knowledge is even less than 1 in 3 people. And less than 50% of countries in sub-Saharan Africa incorporate mandatory sexuality education into their national curricula. So that's a little bit about the data. And this is, of course, very unfortunate, as I said, not only for HIV, but for, just as Claudia said, also mental health, well-being, and related sexual relationships and so forth. And the cognitive, emotional, physical, social, and aspects of sexuality. And as I said, the links between CSE and HIV are very, very obvious. And so CSE is very much a core component of any combination prevention. But that's not the only thing that's important. It's also important for what we call the structural barriers to, for example, access to HIV services, which are very much rooted in unequal gender norms and harmful masculinities and stigma and discrimination. And there is research that confirms that gender transformative CSE is 5 times more effective in preventing, for example, unwanted pregnancies, STIs, and freedom from gender-based violence. So this is really crucial if we are to, if it's going to be meaningful, we need to really tackle the gender transformative aspect of it. And according to a report from 2021, we still have a very long way to go. There are lots of programs out there, but in many cases, they are not being effective. They're not being meaningful, so we need more investments. And so what UNAIDS is trying to do is to promote, and I'll speak a little bit about that later in terms of the Education Plus initiative, but really that CSE should be a key component of any quality education, both within school and out of school programs. And also, I want to mention that the UN Special Rapporteur on Health has confirmed that CSE is considered to be international human rights law standard. So we need to keep that in mind as well. So in sum, we have a very long way to go, but as from UNAIDS, we really try to contribute working on CSE as a way of adolescent empowerment. Thank you.
Thanks. I think, the only thing I would add to that is if we want to talk concrete outcomes, there are two reviews and meta-analyses that I would direct people to. One is one from 2014 that looked at comprehensive sexuality education in low and middle income countries and found that, school-based sex ed is a great way to reduce HIV-related risk in terms of higher knowledge, self-efficacy for condom use at last sex, etc. The second one is a meta-analysis that looked across 30 years of comprehensive sexuality education. This came out in the Journal of Adolescent Health back in 2020. And it looked across a broad variety of outcome indicators and found that CSE can help increase understanding of gender norms, improve knowledge and skills that support healthy relationships, build child sex abuse prevention skills, reduce dating and intimate partner violence, and can lower homophobia and homophobic related bullying. And it's some of those last ones that I want to focus on because I think, obviously a lot of us here come from the sexual and reproductive health space, but I think, a lot of the challenges we get to CSE, especially now, are hyper focused on, are we hypersexualizing young people or not? And what are we doing talking to them about these issues? And age appropriate, curriculum based, gender transformative CSE just makes young people better equipped to engage with each other, with themselves, respectfully. It makes them understand their own health, well-being, and dignity, as Glalia said. It lets them understand how to engage with others respectfully in a social, romantic, or sexual context. And also understands their own rights, their own bodily autonomy, what they are entitled to ask for, demand, what they should be giving to others. And I think it's that aspect that we can all agree that is important for the health and well-being of young people. So I think that I can't overemphasize just how useful, both for SRHR, including HIV prevention, but then also just in terms of making good humans that go out in the world, how useful CSE can be.
Thank you so much to our speakers. I think we definitely see a lot of links between what our speakers have shared. So for example, Claudia and also Andreas both talked about the mental health aspect and also saying adolescent health should be be taken with a holistic approach. So not just physical health, but also mental, social well-being as well. And also what Ian said and Andreas both talked about, we can't just have CSE, but also we need it to be effective. We need it to be gender transformative. We need to see effects of CSE. So thank you so much for our speakers. So moving on to the next question. So the global report also examined 16 key interventions in sexual and reproductive health using data from 136 low and middle income countries for the period of 2017 to 2020. And that indicates that many adolescents still do not have access to essential healthcare services, especially those from marginalized groups, for example, LGBTQI+ communities. So this question is for Andreas, Claudia, and Ella. So what are some of the barriers that adolescents face when they try to access health services, including information and education? And how can external threats like the pandemic, climate change, and also conflict further compound the limited health service access adolescents face?
I think I would like to mention first the obvious ones, cultural, religious, political barriers, and which in many cases also cause the misconceptions that we heard about earlier, and that I think are both non-intentional and sometimes intentional about what CSE actually means. Another barrier, of course, related to that is provider attitudes and practices and behavior when you actually seek a service. The financial barrier is there, of course, as well, poverty aspect. And in terms of the political barriers and legal barriers, I also wanted to mention parental consent laws in terms of, from the HIV perspective, in terms of HIV testing. And out of 195 reporting countries, 73%, not 73, but 70% of 195 countries reported that they deny adolescents accessing HIV consent without parental consent. And of course, that is a very important barrier, especially if people would like to keep their confidentiality, they want to keep the anonymous because these are kind of sensitive issues. So parental consent is definitely an important factor that leave many adolescents in the dark. And I also think that the lack of, as you mentioned, targeted services towards vulnerable populations. It's good to have generalized services, but in many cases, we also need to promote more targeted approaches to actually reach those that are in need of the services. So that's another barriers. And of course, one important symptom of this is the lack of knowledge, that people actually don't know what they don't know their rights, and they don't know what to ask for. So that is, lack of knowledge is another, at least symptomatic barrier.
Thanks. It's funny because we're all kind of saying very similar things because we're all on side when it comes to the challenges that adolescents are facing. So, we can see that they're facing. I'm just going to expand a little bit on what Andrea said. When it comes to things like the lack of services designed for adolescents, I think a big crucial gap in that is that there isn't that much evidence gathering across our health system when it comes to adolescents' use of the health system. So we don't have systematic, across lots of countries, we have systematic data collection on exactly who are the adolescents accessing the services, where are they, where do they live, and what's the quality of the services that they're accessing. So if you're not collecting that kind of evidence in a systematic way, then how are you going to build these evidence-based policies that then better meet their needs? You have health services that are just totally not tailored to adolescents' use in the first place. And then beyond that, you mentioned the service provider side of things. Again, first responders in health, so midwives, nurses, community health workers, if they don't have the support to build capacity to respond to the needs of adolescents and consider them a specific demographic, how will they be able to challenge their own biases when it comes to adolescents seeking certain services? How will they be better equipped to actually meet their needs? How will they be better equipped to collect data and information and spot adolescents who are in need of services and support? There's a huge data gap. I mean, Save the Children has just done a research piece called the Adolescent Health and Nutrition Index. We looked at health policy and financing arrangements in 75 low-middle countries, and we matched this to health outcomes and gender nutrition. And we found that in a lot of countries, they're not reporting on things like indicators like adolescents being able to access free health services, or adolescents having access to HPV vaccine, or SRHR, or contraceptives free of charge. So there are those barriers. And you spoke also, Andres, about the stigma discrimination, which is a key part of it. I think adolescents face a lot of assumptions about who they are, about what they should be doing, but specifically about how much they can understand about themselves. I think a lot of these myths about adolescents don't have the capacity to understand what they need, what they want. And therefore, you have adolescents who are seeking services that might be in their communities considered sensitive, then being fearful of the impact on their lives if they do seek those services. And then the crucial part has to be the conversation around agency. So if adolescents don't have the agency to make decisions on their own bodies and on how they want to live or into the health services they seek, how can they be equipped to find out the information they want? So we have a lot of adolescents who, despite having increasing responsibilities as they transition through the second decade, as Leanne said, they also don't have increasing responsibility in their own decision making for their own health. So need parents or caregivers to sign off for medical access, or they need money from parents, they need phone access through their parents, internet access through their parents, they don't have transportation to access there, they don't even know where to go. So there's such an issue around agency. And in many countries, the law also doesn't protect adolescents in terms of their agency. So you mentioned that lack of consent, not being able to have consent until over the age of 18, or not being able to access a certain service because the law doesn't provide you that access. So there's all these like intersecting barriers. And I think intersection is a key thing that we should think about as well, which is that adolescents are not living for just a health service. They are living holistically in the communities in their lives. And a lot of their barriers are linked to education, linked to health, linked to the environment they live in, social norms, responsibilities from the family. So all of these things can compound and confine them in the sense that they're not being able to be met with the services they really need.
Thank you so much. So I just wanted to address like the parental consent because like being an adolescent myself, if I recall this, I would say this was one of the barriers that was like very discouraging me to access healthcare services because if I want to keep myself confidential, then yeah, this was one of the main obstacles, but also building on the points that I raised before. Which is the access to information and how CSE provides this. With that, I think the other barrier that I also see is that the information that is circulating in the websites or like basically anywhere is not very easy digestible for adolescents. It's written in a very medical language, and then how do we expect young people to understand that and also follow up on the information they receive? Another thing that I wanted to mention as an obstacle is also something that was mentioned before by Leanne, that they're seen as young adults or as children. While this is a very diverse group with their own needs, unique needs that are not really researched. And in the WHO report on the UHC, where they're called like the missing population in UHC, because of the existing data gap on this particular population. So we do not have many, as much information on how to follow up on their health as healthcare providers. Something that that also I reflected on is that when we talk about adolescents, we focus greatly on SRHR or mental health, but also NCPs are something that is not considered as much. Or the data itself does not explore it sufficiently. And when it comes to the challenges that are growing, I think all the things related to climate change, how climate change actually affects us in terms of non-communicable diseases, but also in terms of mental health, like we have climate anxiety and so on. And we do not have much research on that. Let's say the providers that can address it accordingly. Something that we do work on and focus a lot in IFMSA in the last years is self-care, how this can increase body autonomy, but also confidentiality in like accessing the services. So that would be one of the intervention. But when it comes to self-care, a lot of those things rely on digital services. And when it comes to youth, we are like highly digital, but like 71% of youth worldwide in 2020 had access to internet, but when we look at the least developed countries, it's only 34%. So this is a population. So digital interventions are something that only a portion of the population might benefit from. So we also need to explore much more options to overcome those obstacles. So that's.
Thank you to our speakers. So we've definitely identified like a lot of barriers for adolescents when they're trying to access essential health services. For example, Andreas, when you talked about like parental consent, so the parents that know like how can we get the CSE like across to the adolescent, and also like being able to target the marginalized groups, so those with very special needs, so those identified as LGBTQI+, those international migrants and refugees, people living with disabilities. So how can we make CSE more targeted to their needs? How can we kind of tailor it to make it work better for that particular community? It's definitely something we need to think about. And also ELO, so like a research when it comes to, so for universities and institutes. So if we don't really understand what they need, how can we make that tailored CSE for them? And also being able to, so both of you kind of alluded to like the legal aspect of getting getting CSE across, and also the essential healthcare services, making sure that we're able to address that. And also Claudia, so when we talked about NCD, so in like the survey that we did last year, so we tried to identify like, the gaps of medical school curriculum on adolescent health. So a very big one was different types of NCD. So many students really indicated that really a part that's not really covered in their medical curriculum, which was quite disheartening. But yeah, so NCD, mental health, and also focusing on the intersectionality. So we live in like a digitalized world. If the disparity between access to digital devices is there's just such a big gap. How can we make all groups be able to access, for example, telehealth, the things that we need. Thank you to our speakers. This question is for all panels. So one thing that we've been hearing repeatedly during WHO's 75th anniversary is this year's theme, so health for all. So what actions needs to be taken to ensure that adolescents can universally access adolescent-friendly health services, particular SRH related that they need? Start with Elena.
Thank you. Yeah, I wrote a couple of points down. I think, first of all, I want to focus once more on engaging youth and adolescents themselves for the solutions they bring to the table. Everyone has already talked about comprehensive sexuality education. I think I want to focus on that as well. In the Netherlands, it's a front runner, I guess, on SRHR. But even so, when the adolescents were asked what rating they give their comprehensive sexuality education, it was only a 5.8 out of 10. Yeah, so I see some speakers here in the panel making faces. So, and it's not only that they give this rating, but they also have wishes and solutions for this comprehensive sexuality education. So I think these people know what they want, and it's more diversity in their sexuality education. It's more about relationships. It's more about how do I navigate the world? How do I navigate the sexual world? So all these answers to our questions are already there. We just need to listen to them. Moreover, inequality was also named already. I think the diversity of the adolescents group is a factor we can't forget, and we have to think about. In the Netherlands, the contraceptives are only reimbursed up to 21 years, so it's almost all adolescents. But after that, there's no financial compensation for it anymore. So these are things that sound so simple, but are only creating and further worsening inequalities in societies. However, a positive, to end on a positive note, a positive development in the Netherlands was that the abortion pill, which was before was in healthcare centers, is now you're now able to get it at the GP. So that means that it's also financially reimbursed. So that's a big step forward, especially for adolescents who have, it's a more safe space, your GP, to go to, and you know them. So this is a big step forward. And yeah, I think those were my points. I'll pick my opinion.
Thank you so much. In terms of looking forward and what needs to be done, I want to just refer back to my comment earlier that any decision maker with all this information, with all this evidence, with all the data that we've spoken about, should invest in adolescent health. So that's, there are so many good arguments. So that's the first point. Invest and also be accountable towards adolescents. I think it's also a matter of democracy. In terms of UNAIDS, I want to say that we have this flagship initiative, Education Plus, that I have alluded to in my previous interventions in sub-Saharan Africa for adolescent girls and young women. And it's really based on the incredible data that I told you earlier, also about every third second that a new young girl is being infected in that region. And that's 7 out of 10 new infected are girls. So it's really also a matter of gender inequality. So a few years ago, UNAIDS executive director launched this new initiative, Education Plus. And you may ask, why is UNAIDS in education? Well, it's for the holistic approach that was mentioned earlier, the importance of, really SDG. Sometimes you need to focus on one SDG to achieve another one. So, but I'll be coming to that. But the main issue here is really completion of secondary education. So using secondary education as a strategic entry point for the provision of key health and well-being measures. 4 things: having access to comprehensive sexuality education, fulfill sexual and reproductive health and rights, freedom from gender-based violence, and the 4th one is economic empowerment for school to work transitions. So this is what the Education Plus package is all about, and it's being rolled out, and 15 countries in Sub-Saharan Africa have launched this initiative, and there is a political buy-in from the very highest level of government for this. And of course, as it's not only a very good HIV prevention tool, but has so many other, benefits, such as reducing early marriages, unwanted teenage pregnancies, as I said, GBV, but also, of course, socioeconomic of women themselves, but of countries as a whole. So we're very excited about this initiative, and we're already seeing policy shifts that are happening in these 15 countries. And of course, the end goal of this is really to improve the quality of life of adolescent girls and young women, education and attainment, and of course, reduce HIV incidence as well.
Thank you. And forgive me for giving you another bad stat, but there's a statistic that 21 million adolescent girls experienced pregnancy last year, half of which were unintended. And just thinking about that thing of the holistic, the idea is that if the young woman, a young girl, ends up having a child as a child, what is the impact on her life? What's the impact on her economic ability, of her personal mental health, on her ability to live a life full of her own choices? So I think that something that we really want to see, and Save the Children has been working in 27 countries with adolescents, is to partner with adolescents and work closely with them to challenge the gender norms, to share SRHR information, to get them access to SRHR services, and in partnership, meaningful engagement, adolescents leading from the front, adolescents sharing platforms with us and sharing their experiences directly with policymakers and leaders. So we've also endorsed the Global Consensus to Meaningful Adolescent and Youth Engagement, and through our Family Planning 2030 commitment, we've committed to expand our programming on adolescent-led accountability and advocacy. That's one of the key things I think we need to take away from this, is we have to listen and engage and partner closely with adolescents. And secondly, I think we need evidence. We have the evidence on the poor outcomes, but we don't have enough evidence of what governments are doing in terms of what policies are out there, what financing, what investment is happening. There was a statistic that a research that came out a few years ago that less than 2% of global ODA is going to adolescent health. That's just health. So imagine, do we have that scoping in terms of investments globally on adolescents, generally around their well-being and their health, education, safe societies, access to information? So we need data that can hopefully drive investment. That's my last point, I would say, is we really need strong investment from government and leaders and civil society to invest in this issue and to make a global declaration. I'm going to talk about the Global Forum in October, a perfect opportunity for policymakers to make a declaration of commitment to adolescents as a demographic. Because if we don't do that, we won't, as we've heard from all the speakers today, we will definitely not meet our sustainable development goals or any of these ambitious agendas. Thank you.
lot to follow. So I think just a couple things to build on what Elena said about, I think we've all mentioned the importance of engaging with adolescents. I think it's really hard to do in a non-tokenistic manner. And I think that that's where this space is struggling at the moment is, adolescence is 10 to 19. These are people who are not at the age of majority in most countries. They have different schedules. And so trying to meaningfully and systematically engage adolescents is a challenge. And it's one that we need to rise to collectively and make sure that we are engaging them systematically on their terms in a power safe environment and also in a remunerated manner. And I think that that's something that, all of us, all of our organizations, we're all taking really powerful steps in that direction, but there's absolutely more to be done. I want one reason when we talk specifically about adolescent friendly health services, why this becomes important is when we look at where adolescents are already going for health services and specifically SRH services. Claudia mentioned this, that we saw both in the pandemic and more broadly, that young people are relying heavily on digital channels, relying on self-care. WHO has done just amazing work both in the area of self-care and SRHR, as well as digital health as well. And I think that we've seen that young people are rapid and enthusiastic adopters, for example, of getting their contraception through pharmacies and things like that. But if our inclination as an ASRH space is to step in and say, okay, the young people are going to pharmacies, they're going in, they're coming out, I'm worried that they're not getting counseling, I'm worried that they're not getting more information, and we co-opt those services to, sit someone down and do a screening process, mandatory counseling, we're going to run the risk of sending young people underground somewhere else again. And so again, I think that kind of highlights the importance of saying, we need to meet young people where they're at, but on their terms. And then I want to say for Strength and Health System, kind of capitalizing on the fact that we have so many current and future healthcare providers in this room and online, is that we know what needs to be done to make adolescent services more adolescent friendly. We know that we need longer opening hours. We know that we need to make them accessible. They need to be private. They need to provide adolescents a respite from community stigma. They need to be independent of parental consent. But the interaction with a provider is tantamount. And I think a lot of WHO's own work on adolescent health and ASRH has really emphasized the role of providers. And so I think that's one of those things where we can have these global conversations. But if, I'm lucky enough to be in the room with people who are going to be providing services to adolescents, there is so much that a healthcare provider can do to just normalize talking about this space, to not make it something that sends a shiver of fear down an adolescent's spine, but to just make it like, yeah, how's, are you eating well? Yeah, and how are your relationships? Do you have any partners? Like, just normalize things. So that's my plea. And I think that IFMSA has always done an amazing job, I think, in kind of seeing where there are gaps and having the members step in and say, no, we want training on this. We want to be better at these things. And so I just encourage, any current and future medical providers to really rise to that challenge.
So I have my own mic. Thank you, Leanne and Johan, for mentioning the survey and our work on that. I think that was actually the point I wanted to bring, which is building curriculum that is based on the gaps, that surveyed the gap first. And if anyone is interested, we have the QR code to check the main outcomes of the survey that we have. So I would say the best practice we can start with is to provide comprehensive incorporation of adolescent health within medical curriculum, because it's usually when we surveyed, it was mostly within pediatrics and so on, while other sectors or other subjects are not lagging behind. So we need more strategic incorporation of those topics. And I think the most bizarre observation from our study is that the longer we study, the less confident we become in managing health of adolescents. And our conclusion from that is that we also might realize that adolescents is not like the same group, but they also have different challenges. They come from different socioeconomic backgrounds. They do have different levels of ability, language barriers, and so on. So I guess that was something that was very surprising for us to discover, and that's why we want to build forward with that and create like basic competencies, and that will also require a lot of soft skills because communication and building safe spaces will be very crucial in ensuring friendly climate for adolescents in the healthcare settings. So we would like to also advocate later on university levels, but also like apply it universally. When it comes to other things that I wanted to bring up is, first of all, also investing in research that manages the gaps that exist right now and recognize adolescents as they are, which is diversity. And the other thing is to also emphasize how self-care can be the meaningful tool to achieve UHC, especially in that population. So self-testing, so that might also manage the gap that you, Andreas, mentioned, that people can do testing at home without like any suspicions about or people that might perpetuate stigma around those services. And also we spoke a lot about the legal barriers that they face, but also the economic barriers, because we are also once we graduate, we are also at risk of being unemployed or living in poverty. So I think having the free services, but also looking into those legal barriers would be another great intervention that will improve the access to healthcare.
I just wanted to mention one thing that I forgot in terms of Education Plus, and because it's important, and it's the fact that UNAIDS is co-leading this together with four other UN entities that are very active in this Education Plus initiative, and it's UNICEF, UNFPA, UN Women, and UNESCO. So I just want to underline that as well. And if you want to have more information about this initiative, you can come to me after the event, or you can also check our website.
Thank you so much. We can definitely share with another group as well. Well, a lot of takeaway. I think many speakers really focus on called on us to focus on adolescents. So we can't just be here kind of brainstorming what's best for adolescents. We have to involve them in their care. We have to consult them. So why what else can we do to help you access the care? And also just not focusing on adolescents as a group, but also thinking of them as like very unique individuals that have very unique needs of their own, and also have come from all walks of life. And also Andreas, you talked about like something very interesting. So accountability, right? And also Ella alluded to. So how do we keep like governments accountable for the promises that they've made on safeguarding adolescents' health? And how can we like kind of sustain it? How do we monitor our progress? So we went to an event the other day, Lives in the Balance. So that was so social accountability was something that like brought up a lot. So definitely something to think about. And also use it like how do we involve youth, adolescents, but in a non-tokenistic way. So how do we not just kind of say, oh, like we're involving adolescents in our care, but actually taking that initiative to actively include them, use adolescent inclusive language, make them more financially accessible, make the hours longer so they can access, and ensuring their privacy, confidentiality, allowing them to access the care without intervention from their parents. So how do we actually make those changes? How do we actually implement them? Be very important. And also data and research are brought up very frequently. So ensuring that, again, so trying to understand exactly what needs, and also use that data to go somewhere. So use that data to drive investment, use that data to tell governments, to tell everyone in our community that this is something we're lacking, and this is something that we need changes in, we need actual actions in. So big thank you to our speakers. So moving on to the next question, as highlighted in the report itself. So the Global Strategy for Women's, Children, and Adolescents Health. It has made significant progress and encountered challenges since it was first implemented. So this question is for Elena, Lena, and Claudia. So reflecting on the latest report, what are the gaps and opportunities we can close and galvanize to further advance adolescent health and well-being at the global and national levels?
Thank you. Yeah, so I don't know if all of you read the report. I think a lot of things that we mentioned during this talk are things that are opportunities, and I think we've spoken on that enough, or not enough, but we've spoken a lot about it. So I wanted to highlight one gap. I'll quote from the report first. It's mental health. Mental health has also been impacted by the COVID-19 pandemic. Estimates for the year 2020 show a global increase in major depressive disorders among the general population by 27.6%, and an increase in anxiety disorders of 25.6% since the onset of COVID-19 pandemic compared to rates prior to its start. And I find this shocking. I think mental health, as well as sexual and reproductive health, which we've talked about extensively, is also a stigmatized topic. So that's a second topic for adolescents to have stigma on. And I think it's also rooted in the fact that they don't feel heard. They don't feel that their solutions are solutions that are also proposed by their governments. I think being an adolescent in itself is a very disruptive period of time in your life, and we already said there's a lot of inequality, a lot of difference between adolescents. You can't say an adolescent of 12 years is the same as 19 years, and they live through that change. So it's not very shocking that mental health is a very important topic for them, but it is, to me, shocking that they are struggling with it so much. And I do think it's because they have a lot of solutions. They have a lot of solutions for the whole world, and not only on their own health, but also other topics of economics, of climate change, which was already mentioned. And they want to be the change. They have to be the change, but they're not being heard.
Yeah, I actually think you provided a wonderful overview of the high points of the report in your opening. And so I think, when we celebrate the successes, the declines we've seen in things like adolescent pregnancy, child marriage, female genital mutilation, progress on HIV, infection prevention, I think we can say, like, great, good job, good job, world. And importantly, given that adolescent health was not really on the agenda prior to the global strategy, prior to the SDGs, this is a great way to look to the point that Olu was making earlier about, the data for continued support and investment in adolescent health, and say, look, we have done things well. And with continued investment, we can continue to see progress on these indicators. I think to Elena's point about not everything is all shiny, what we've seen is that areas have been overlooked and mental health has been brought up, but also areas like sexually transmitted infections, intimate partner violence are areas where we've just seen stagnation. And I think we need to ask ourselves why that is, and really kind of redouble our efforts to address these things. And then the last thing, and I mean, might be that Claudia talks about this too. I think this idea of intersectionality is critical. I mean, we've talked this entire panel about why adolescents face these additional challenges. Now, as we globally are starting to understand the gravity of intersectional vulnerabilities, when we start to talk about climate, we start to talk about conflict studies, displacement, migrant communities, etc. Add adolescence on top of that, and you've got just these added layers of risk or vulnerability that we need to make sure that we're addressing. If we're not doing enough to meet our obligations to communities that are struggling, the adolescents within that are even more invisible odds. And I think that that's where we kind of need to challenge ourselves to do better between now and 2030.
Alright, so when it comes to the pandemic, I want to bring a little bit of optimistic approach to this. I think it was a great precedent because the data that we have is vast. Like we do research a lot when it comes to mental health and adolescents in that context. So I think it is a great precedent for like measuring adolescents helping other health emergencies that COVID was, and still is. But also there are a couple of shortcomings because adolescents were also researched very late in the pandemic. And also we need to take into account how the data is represented when it comes to regions, because most of this data come from the global north. So yeah, like that would be my first positive outcome of the strategy and how the COVID affected that. But when it comes to the gaps of the strategy, I think the main point that I want to bring is that it focuses a lot on like the binary division of genders. Like we mentioned girls and boys all over the document, but then we look we overlook the non-binary population and transgender people in statistics. And when it comes to young people, those the population of people that are gender diverse is higher than other populations. When it comes to other aspects, I also want to bring the access to contraception in the report. There is the access is growing, but it's growing very slowly. So hopefully the handbook of the WHO from last year and also updating the guidelines on ensuring access to contraception to adolescents will somehow help to boost this progress. And I think the most upsetting thing is that we do still have non-changing prevalence of intimate partner violence. A couple of years ago, we still had 1 in 3 women, and then in the strategy, we also have 1 in 3 adolescent girls that face that throughout their lifetime. So this is something that we're also lagging behind, and I think this is not given enough attention. And I think the last point I wanted to bring is also not mentioning those interventions of digital health. I think the COVID pandemic changed a lot how we perceive telemedicine. So I also understand that the strategy was implemented in 2016, which was not a big topic back then, but I think we might also discuss adapting it to the new reality that we have, and also adding the opportunities that digital health will bring. So yeah, that's it.
And I have kids here are the speakers. So I love like video. So well, first of all, like you brought up like COVID-19. So how in the report there was like a lot of mention on how COVID-19 kind of impacted not just adolescent health, but also maternal health, children's health. So like being able to understand like how in those pandemic, in the pandemic setting, how that kind of impacted our ability to care for adolescents is definitely very important. And also engaging them, making sure that they feel heard, making sure that they are the ones that providing the solution is very important. And also Leanne, so not like along the way, we shouldn't just be able to like focus on, we should definitely celebrate the wins. For example, the wins in the Netherlands, also using education plus programs. But also it's important for us to think about like what's still lacking, what more can we work on. And also you mentioned in disaster settings. So I consider myself coming from a very privileged background, being able to go to med school, being able to have things to eat, have a place to sleep. So even I complain about, okay, so this and that is, I'm not like having access to the top services I'm entitled to. So imagine adolescents from disaster background. So it's just, yeah, it's a very starting point. So thank you for bringing it up. very important research project also talking about like the intersection between digitalization and adolescent health. So I think digitalization definitely like serves as like really like a true science work. So one side is be able to like kind of bring telehealth closer to adolescents. But on the other hand, it's if we're not able to ensure equitable access to things like internet, digital devices, how are we gonna ensure that it's not gonna exacerbate that inequality? So now we'll start and round of applause for speakers. So that's all the questions that we have. So we'll start taking questions from the audience.
Hello, first of all, thanks for the incredible discussion. My name is David, I'm from Spain, I'm here on behalf of the IFMSA. Okay, my question is regarding related to the fact of the comprehensive sexuality education. It's clear that the comprehensive sexual education requires taking into account a lot of factors, such cultural aspects, the economic context, etc. And my question is, how do you believe we can reach a middle ground between the evidence-based knowledge and the youth involvement, and how should cultural currents be included in the guidelines to develop comprehensive education?
So you're asking about how we can reach a common ground between the evidence and then the youth participation to ensure that they're incorporated. That's a great question, and thank you for asking it. I'll answer for me, but then obviously other panel, please too. I think the key thing there is, okay, the evidence is so valuable because it helps support social norm change. So I think a lot of myths, a lot of tradition go into how communities view adolescents' role, access to this kind of information. If you can support that with evidence and with impact of the evidence, you can say to a community, you were able to give your girls, for example, access to information, maybe your girls would be in better health. You might see less infection, leading, menstrual health related infection, for example. So I think the evidence is really valuable as an influencer to enact social norm change. And then in terms of the common ground of like engaging adolescents, I think it has to be led by adolescents. So if adolescents have a part to play in sharing their information and sharing their life stories. For example, in advocacy, we often use human stories. So we have the technical language, we have the evidence, but we think, okay, how do we get our audience to really, A, be interested, and then even think that this is an impactful thing that they should care about? And it all comes down to using human stories. So that is the value of having adolescents be at the forefront of these discussions. Or if you're talking about any other group, having that group be at the forefront, be at the table, is that they get to share their human stories. And there's nothing more influential than sitting with somebody, hearing their life story and empathizing with them, and then thinking, I have to act on this. And that's the value you get when you engage adolescents. And you can cross that thing from the technical language that has the evidence, but is maybe a bit dry, and people don't really want to read and really want to report, and then the real human life impact story. Here is how my life is day to day.
Okay. Thank you. I think the storytelling part is an important part of education, and also like helps to with emotional part of learning. But I also wanted to bring the point on informal CSE, because that's the growing attention. For example, UNFPA puts a lot of emphasis on how important it is to have informal setting of CSE, and the role of youth is here very, very wide. I would say the peer education programs are very successful, and they can benefit the communities, because that's how you can also build better rapport with those that listen. So if there is a young person providing CSE to adolescents, they are also more open to ask questions, to approach afterwards, and so on. So I would say that here is the role of youth, and of course we need to advocate for having it applied universally. But in the meantime, we also need to remember that this is how we can do it and still manage those gaps.
I don't know, just on the UN's technical guidance for CSD, which is led by UNESCO, but WHO, UNAIDS, and several other UN agencies sign on to it as well. That technical guidance is, large, it's curriculum based, but it's global. So it's always adapted to country settings. And I think the most recent guidance also has an adaptation suggestions and products about how to tailor it to local context involving young people as well as other important stakeholders in there. So there's absolutely a space for both.
It's very convenient to be last because so much powerful responses already to a very good question. What I wanted to add from UNAIDS perspective is that I dare even say that community engagement is really at the DNA of UNAIDS, including youth. And so community-led services, community-led and youth-led, that's really key. And also to reinforce the point about the evidence and how powerful that can actually be. And even if it's kind of adapted to a cultural context, there is still some facts on what actually works. And if, again, coming back to the HIV perspective, what actually works to fight the HIV epidemic. And of course, it also has other beneficial effects.
Hello everyone. My name is Mohammed. I am from Egypt, and I have a question regarding the confidentiality of the adolescent patients or the adolescents who seek sexual and reproductive healthcare. During a training before, I was conducting a session about the ethical component of the patient's rights, and the confidentiality was a main core of them. And there was an argument or a discussion about such a right for an adolescent patient. And at the end, we came to an agreement that it's for protecting the confidentiality for patients is a key factor to encourage the adolescent patient to seek healthcare services. But yet there was a question that is there any scenario or case scenario that a healthcare provider has the right to breach the confidentiality of an adolescent, like in cases of the sort of abuse or self-harm or anything else? I want to know more about this from you. Thank you.
So thank you, Mohammed. I think at least how it exists in Poland, it's not really a breach of confidentiality, but legal right to the parent, because the consent on like any medical procedure is a shared consent. So the parent also has to have access to the same information as adolescent. So that's at least how the law is based in my country. And I think even if you have the law, this is one thing, but application and the positive attitudes of healthcare provider is another one. And that's why we were trying to focus more on like building those positive attitudes and safe spaces in healthcare settings. So I would say this is like one step that we want to put forward as IFMSA.
Hi, everyone, and thanks so much. It was very inspiring to hear from you. So my name is Renee de Jong, and I'm working actually on the organization of the Global Forum for Adolescents this year. And I think this is a really exciting opportunity, and it has been so interesting to see. And I love what you said today about sometimes we have to focus on a different goal to reach the goal we want to reach. And for example, yesterday, I was with the nutrition community where we discussed about school meals. And I see so many connections. Like if we have the school meals, we can keep the kids in school and we can actually give them this comprehensive sexual education they need. And as we have this opportunity this year and accountability, I think to actually take this agenda forward and commitments by policymakers is so important. I would love to ask you all, how can you help us and how can we make sure that we have as many as possible organizations involved and as many young people, because we have this opportunity now this year. It might not come back anytime soon. So I'd love to hear from you how we can make the most out of this opportunity together.
Yeah, I'm people first. Well, before I was involved in this work, I didn't know about the global forum, so I think there's a big step. And I'm thinking, how do you reach young people? I think social media is a big part. And to build on that, we've talked about inequality as well, and I think we do that greatly at the WHA, but hopefully also at the global forum, look at the inequality too, because is it a hybrid event or is it a
You're online and we're exploring. We're also having the opportunity to respond on that.
Okay, that's a great way to involve people, yeah. Let me think a little bit more on the question. I just think social media now, but maybe if other people say something, then I'll have some different ideas.
Thank you very much. Very inspiring. I can come back to Education Plus, our initiative, because we have a very strong kind of movement, also a grassroots movement. We also have a particular young women's engagement hub that's with girls and young women who actually feed us with the information that and so that the response is really adapted to reality because they know exactly what's needed. So if there's any way we can join forces, that'd be great.
Yeah, thank you. I think I'm just going to comment on the thing about, I'm very familiar with the global forum myself, but on the thing of, the intersectionality again. And I think we're still maybe talking just to help people, or maybe just within kind of familiar groups. And maybe a part of drawing those links is looking outside the box and thinking about who else doesn't know about the global forum, and who else isn't related, like indirectly to the issues we're talking about, but has a key part to play. An example, I was just in an event about climate impacts and maternal and newborn health, and they spoke about the impact of infrastructure, meaning architects and buildings, and how buildings can protect families against heat stress. And I had not thought about engaging with engineers and architects on an issue that leads to a health issue. So I think that was a perfect example of how sometimes when we're within our own context, we fail to think about those wider links. There's maybe something, this is just a guess, there's maybe something there about who else needs to come into the room that isn't already considered.
A very concrete thing I would put forward would maybe be more lead time. So if I don't know how many of the young people that are floating around this room see each other often at global events, but that was something I'm seeing a lot of nods. But that was something that we found a couple of years ago. I was involved in putting out an interagency guidance on how to meaningfully engage young people in the context of digital. And that was something that we had like 100 young people in the room, and half of them were like, "Oh, I saw you in New York. Here we are in Turkey." And I think if you want to go beyond the same incredibly talented, eloquent individuals that all of y'all are, you need to give time to get your calls. You just need to give time to get out to national networks. I think the idea of having national events is fantastic. But I think if you want to go, like, I know there's some really robust international networks that are represented here in Geneva right now. And if you want to go beyond them, you've got to double the amount of time that you're doing for a call, and then be willing to wait, and also be willing to take a risk and take a chance on people that once your message has gotten out may not present as shiny and polished as many of the folks who are fortunate enough to be able to operate at the international level are, but just be willing to do that.
Thank you. So when it comes to my point, I think another concrete action is to reach out to youth councils. This is something that exists in a couple of countries that under government. So this is like a collective of different youth-led organizations, and I know that this exists in Portugal. It also exists in Poland. So this might be a way to reach diverse young people, because they do exist in within young people spaces. So yeah.
Thank you to our panel. So hello to those of us who are not very familiar with Global Forum, would you like to introduce?
Okay, I should try. Maybe let's go to our next step.
So there are 1.8 billion young people in the world today, and what the IFMSA has been doing, we've been doing a lot of the technical work. So exploring what are the different domains of what is needed for adolescents. And then the next step, make a real progress we want to see. It's about policymakers turning that those knowledge we have, which we're finding, into policies and into funding for adolescents. So what we try to do, we created this moment 11th and 12th October on the Global Forum for Adolescents this year. It's going to be virtual. We're exploring if we're going to have different sessions in different locations, but for sure it's going to be virtual. We know travel is not necessarily accessible to everyone. Then, in addition to that, we have the What Young People Want campaign. So we're trying, we've done the science, but we have not necessarily heard as much from young people themselves. So we're trying to reach 1 million young people to telling us, answering us directly the questions, what they want, which then becomes an advocacy tool locally where people can turn in and see in a dashboard, okay, this is what people have said in the Netherlands. This is what they have said in Thailand. So they can use, we can use it at a global scale, and they can use it for their own advocacy locally. Then we're inviting everyone to organize local, national, regional events where you bring people together. This I've seen right now, very small community gatherings where they want to discuss in Congo what their priorities are. I've seen UN agencies stepping up saying we're going to organize a regional forum in the Arab region because we have priorities there. I've seen universities stepping up, coming up with ideas, inviting their students to host activities. So there are a lot of different ways to engage, and I think the most important thing is for people to use this opportunity to put adolescent well-being on the map in their country according to what is most important for them, because that's something you can never really do on a global level, right? You can touch on a lot of topics, but it's never going to be very specific for what's needed. And then with that, we are also inviting any policymakers to come to the global forum and commit to these new policies and funding for adolescents, hopefully. But this will require some collaboration.
Thank you so much. I saw questions from over here. Hello, my name is Celine. I'm from Tunis. Thank you for this interesting discussion. I think Claudia said about periodization and its importance for adolescents, etc., about sexuality. But it actually triggered me a bit, and it triggered. It's good. It created a question in my head, which is like for example, in my country, peer education is, I think, making 99% of the work about sexual education and education for adolescents in general. And we have fundings, which is also good, and we also making a lot of advancement. But at the same time, peer education is targeting privileged people who already have access to information and also have access to education. People who and adolescents who have problems with poverty, hunger. They don't have even access to schools. They don't have normally access to peer education. So my question is, or maybe if I want an advice on how to work more on advocating for sexual education in schools, primary schools, how to advocate and how to get support from international organizations in order to convince ministries to implement sexual education programs in schools, because it's going to be more accessible. Not enough, I know, but at least it's going to be more accessible to people who are not privileged. Yeah, thank you.
Yes, I should answer. So I think I can use the example of my country and how we deal with the CSE programs within IFMSA Poland, and also like giving the examples of other countries that I know have those issues. So the main obstacle that IFMSA has in terms of like reaching different populations is that most of our activities are centralized where the universities are. So we are very rarely like traveling to like hardly reached populations. I think one of the solutions that we had in my local committee is that we were looking for different grants in like smaller cities. So they actually like encouraged us to go to those areas and provide services there. But I also know that in other NMOs, they do community outreach. So there's like a trip to certain areas, and they provide like a whole day of CSE there, or targeting specific populations and doing that. So I would say that the first step to overcome the issue that you said is to understand that we are doing it for like a certain population that is already privileged, and then also looking for solutions how we can reach those who are not yet reached, and how we can still benefit from that in terms of like also broadening our horizons and understanding the needs of different populations, but also the economic aspect that I meant the grants. So that's
Yeah, I think there's an enormous, like, this is where the role for me of civil society is just absolutely critical, right? I think that, you know, you are not the only person who feels this way in Tunisia. I'm sure like there are many others. There's highly educated medical providers, teachers, parents groups, non-governmental organizations, people who support the health and rights of adolescents. And the evidence is there at the global level, even at the regional level, to make a case to parliamentarians, to ministries of health and education, because CSE is an education sector intervention, to come together around that. And there's some great country examples that we can chat about over lunch if you would like, where that has been the case. And I would say reach out to, you know, your WHO country offices if you want that support. There's international guidance, but I think what's critical is what we talked about earlier, this idea that, you know, the arguments for CSE can be made around what are priorities nationally. And I think whether that is, you know, rights of the child, whether that's bodily autonomy, dignity, respect, like those are all very valid arguments around which you can say we need comprehensive sexuality education. The evidence says if we do this, then we have stronger, more capable young people. And I would also say too, just I think in general, I think it's so important to engage young people around their health. At the same time, I think we always have to be very careful about your health and well-being not becoming only the responsibility of young people. Like we can't say, yeah, peer educators have got this, the rest of us can kind of tap out and go about our business. And I think that that's where, as someone who works in sexual health, I would say, again, there's so much we need to do societally as an SRHR community to create environments broadly that we're talking about sexuality, talking about the changes in our bodies, talking about intimacy, you know, romance, sex. It's just something that we can do together. And that takes the burden off of young people on social media. It helps kind of address some of these inequities as well.
Just really quick things. I think the last two speakers did say a lot of what I was going to say, but I think it's frustrating as an advocate. I'm an advocate, and it can get very, very frustrating when you're pushing against a wall, but you don't have to do it alone. So I think there's a thing of finding your group, which I think you sound like you have a group. If you don't have, there are groups out there of young people galvanizing and gathering, but also importantly, finding your champions in your communities. And they can be surprising champions. Sometimes someone who you think is an opposer, with a conversation, with some information, could become a big champion. And that, whether that's a faith-based leader or a leader in the community or community health worker, I think often finding your champions that can support young people to then change the minds of others and advocate to the right people who make the decisions. So I think that's a key tactic in advocacy.
Yes, I totally agree with that and with the previous speakers. And what I want to add is also the importance of continue to advocate with governments and decision makers and finance ministries in order to invest more in the education sector, put more money into that sector, and to really focus on the universality of the access so that you actually reach everyone. And to sharpen our arguments why this is important not only for them, but also for the whole country actually, and for the social economic development of the country. So, and again, the Education Plus initiative is 15 countries. It's in Sub-Saharan Africa, so it can, the lessons learned can be for many other countries as well. And these 15 countries have committed at the highest level that they actually will invest more from their domestic resources in the education sector. As I said, to try to have universal quality education, and with the plus aspect, as I said, CSE, SRHR, gender-based violence, freedom from that, and also socioeconomic transitions. So again, really investments, it needs to come both from the kind of government and all the work done by the civil society.
Just to add a couple of more words, I think someone already said it, you don't have to do it alone. And I think when you have a really good example of peer education, maybe in a society or a group of people that's more privileged, you can use it as a best practice to show the government, look, we're doing this, it's having an impact, it's having influence, but we need to take it broader, and you don't need to do that alone. And I think from what I've learned is sometimes governments, they talk about achieving different goals, but they find it very difficult to see how to implement it in practice. And when you have that example and you can show them, that is a very, very good step towards implementing it in the whole country or the whole region. Yeah.
Hello, my name is Rita. I'm from Portugal, and I would like to touch on something that you were saying. So when we discuss a goal that we want to reach, we have our allies and we have the people that oppose these things. And this opposing can be direct and this opposing can be indirect, because social determinants are very important here. And if people don't go to school, then it's more difficult to reach education. And when we discuss these things, we have safe spaces of people that want to advocate for this. So I would like to know how can we broaden these safe spaces and bring people that oppose our ideas to the conversation to make them our allies. So because I think that's one of the biggest difficulties I find. So I would like to know your opinion on this.
I don't know if I have a solution, but I certainly have an experience. I mean, I have personal experience. I think I'm going to go back to the human stories again. I think in a lot of the most sensitive topics that we discussed today out there in the internet, in real life, a lot of it is people who have no experience of somebody in that situation or somebody from that community. So for me, I really feel like overall, most people, maybe this is a bit naive, are inherently want to do good. What they think is good is different, according to a lot of different people. The way they view their goodness is different. But I think overall people want to meet somebody and want to know who they are. So for me, I feel like human stories, and of course you have to protect a safe space when there are people who you don't want to be at harm, and that's the challenge. And I think it's something that we're all working together to work out how to create these safe spaces that work for everybody. But I certainly think actually taking away the strangeness, or how do you say, like the idea that this is happening over there and I don't know anyone like this and this has nothing to do with me, to actually meeting somebody and having a discussion, it can really challenge a lot of your personal biases to get around anything. Whatever, fill in the blank, it can challenge it. And it might take time. The other thing is to give it time, because I don't think these things happen immediately. But I've seen in practice people going from not wanting to listen to becoming more willing to listen, becoming more willing to understand, to becoming, more active in a particular community or whatever it is. I think social behavior change has a lot to do. And I'm not personally a social behavior change expert, but I think the human stories really go a long way in impacting people to at least go from blocking to willing to listen.
Thanks, and I think that also applies to the spaces among governments, that there should be more of this kind of informal discussions and less of the formal polarized, this is them, and where everything becomes really locked. So I think it would be great to have a little bit more of some informal discussions among, different governments with different opinions, because I agree with you. I think all governments would like to do good. It's just that they have different opinions on how to achieve that goal. So I think that from both the different spectrum of opinions, I think everyone probably needs to listen more to what the others actually think. And then, of course, there's evidence there as well, as, for example, coming from a UN entity, our role is to provide them what's working. In our case, it's the HIV epidemic. In other cases, there are other examples. What actually works if you want to reach the SDG on HIV 2030? Well, then you have to do this, this, and this. CSE is a crucial part of that. So that's a simple fact. But then, of course, I think you need to have this kind of space to more, also in a more informal settings, not only the formal ones.
I mean, the only thing I would add is that I think that this is an area where a few very loud opposition voices are able to potentially derail something that I think I agree with you. I think that a vast majority of people probably don't have strong opinions one way or the other. And that's where this idea of like meeting people where they're at and understanding what their priorities are for the young people in their communities, for their children, for their neighbors are. And I'm pretty sure that they would be very much in line with, say the objectives of CSE or adolescent health access, improved access to health services for adolescents. But I think it's a really interesting area where you get really loud, concentrated, strategic opposition that runs the risk of, derailing sometimes years worth of work. And I mean, I was talking to the head of our ASR, Adolescent Sexual and Reproductive Health portfolio, and he gave me the example that I think a couple of years ago, country of Zambia had some very powerful opposition, some of which came from outside, where there was a national movement to try to derail CSE, and it was a national network of civil society actors, including healthcare providers, parents groups, youth groups, et cetera, who came together and very firmly said, no, this is why CSE is important to Zambia, and it resulted in the Zambian government coming out with a strong statement affirming their support of it. So, yeah, I mean, I think informal conversations, and I think also just standing firm and staying with the evidence and the science in the case of opposition, which I know is getting more and more challenging to do in this space.
Hi, I'm Grace. I'm recently graduated from medical school from Peru. And I wanted to ask you a question related to non-formal education, because from my perspective, you were sharing some data related to how we should include more comprehensive sexuality education in curricula for schools, and how adolescents should be involved in this education. But from what I've seen in Peru, sometimes this education is included like lectures or like in the perspective that they don't really understand the information that is provided. So sometimes non-formal education plays a key role there, like some workshops or some initiatives that some civil society approaches have some ideas to implement, and maybe adolescents feel like more comfortable learning in this environment rather than in a formal education platform. So I would like to know if there are some specific frameworks that are evidence-based or something that can really tackle this kind of education approach for adolescents, but to implement it into the curricula. Because I think the idea is that they can have education, because we are all advocating for have CSE education in the curricula, but we need to know how they are going to learn it, like if this is impactful for them.
I can go because Leanne and I just opened the same document. So there is a guideline from UNFPA that is out of school comprehensive sexuality education. So that provides like a great overview how it can be implemented. So that might be the use, but also we have the technical guidance that can be complementary to that. But I would also like to reflect on what you just said that, well, the education sector has very conservative view on how education is provided. And I think with the new approaches that civil society provides and like the workshop style of classes is like a fresh air in that setting. So I think it is also very beneficial to involve civil society in that. And yeah, so that would be my thing.
The only thing I would add is that was UNFPA in collaboration with WHO and UNAIDS and UNESCO.
You don't have anything to add?
Thank you. So, another round of applause for our. All right, thank you for all the questions, and, again, thank you for the speakers for taking the time to speak with us and share all your insight. So maybe like we can share the documents with our group as well afterwards. Yeah, so we'll be having our closing now. So this year is the 75th anniversary of the WHO. While we are celebrating all the wins along the way, it's also important for us to think back and reflect. So who did we leave behind? As the importance of adolescent health becomes more and more apparent in today's community, the need for concrete actions is greater than ever. The 1.3 billion adolescents, each presenting with their unique needs, coming together as an integral part of our health and political agenda. However, we often fail to recognize the unique needs that each adolescent presents. And that's why. So ensuring that they grow up in a safe and healthy environment, that they have access to the health services they need and receive equitable support to reach their life goals are vital. There is no health for all without adolescence. So that concludes today. Well, we do have a small refreshment behind those doors, so we can have some conversation and sandwiches. Yeah.